to Van Buren, moving basically what is their problem to become our problem. I don't think that's reasonable. I don't 100% object to some solution to this traffic problem, but let's do it in a considered way. The proposal that I've seen so far cuts across our trail in two places, cuts off our community property so we don't have access to it, and this road tends to be one of access. So we should look carefully at getting access to our property from our community. Thank you.
Thank you.
Hello, Honorable Chair Wheeler and Honorable Supervisors. My name is Grace Lintner. I'm from the Coles District. And first I want to say thank you for the COVID-19, covering the COVID-19. And I just wanted to say I have some pocket hand sanitizer if anyone ever needs any. So I'm going to be carrying that around, and it's great that we're going to have hand sanitizers in public buildings. But I'm going to carry this around and be using this a lot. I won't be able to make the meeting tonight, but I just, so I'm talking now. I'm requesting that you take item 12B off the consent agenda for tonight's meeting and discuss it if you need it. Then please vote no on it. This is an issue which Prince William County citizens do not agree on. It is an issue which has resulted in hours of public comment time this year and will most likely again. This issue divides the county and results in delaying the work of the people's business. Since Chair Wheeler's resolution to, quote, urge members of the Virginia General Assembly to address gun violence prevention in Virginia by passing gun safety legislation, unquote, failed to be voted on because it was determined not to be a county issue. I think it's not in the interest of it's not Prince William County's business and therefore should not be passed. Thank you.
Thank you.
Chairperson Wheeler and the board. My name is Bill Shelton. I live in Four Seasons since December of 16. And I just wanted to second what Terry had basically said there. My heart goes out to the people at Montclair for all the problems they have on Waterway Drive, but I don't believe that this Van Buren Road is going to solve their problems, and it's going to create more problems than what we have right now, I believe, especially in my community and Copper Mill and some of the others. I asked the board that they reconsider and not fund this Van Buren project, and I just wanted to say that. Thank you very much.
Thank you. Do we have anyone else who wishes to speak that did not have the chance to sign up in advance with the clerk?
My name would be Colin Robinson. I'm in the Gainesville district. At least I live there. And I'm looking forward to driving on Van Buren Road. I'm here for two items. First is I want to thank the board for the hard work it's doing on a budget that has needed to be challenging and will continue to be challenging. And it's being challenging because for about 10 years, the prior boards kicked the can down the road, did not properly fund education and other things. I personally was at a town hall in my magisterial district where someone told me about the 10-year plan they had to fix the problem that they had been active in voting on. And I'm sure he's been quite busy opposing the tax increases. I, like others, don't care for tax increases. I do care for the children, and I want them to be properly educated. Secondly, I don't know how 12B makes sense to me. I thought that it was all of our responsibilities to peacefully exercise our rights. And certainly, I don't think I could qualify the behavior enrichment to have met that by whoever was there. So, thank you all. Have a good day.
Thank you.
All the meetings I've come to, I never, ever knew.
Could you introduce could you give us your name and your magisterial district, please?
Yeah, I'm Nathan Moore, Coles District. This is so useful. Yeah, I didn't even notice the full agenda. I'm also going to talk on 12B. I recognize that each member of the board can, do and commend as they wish. And I spoke on this issue before in a previous week, and we don't have enough time to fully go into every single bit that has gone into the events that led to January 20th. That said, I also do oppose these massive sweeping gun bans, so it's not really about the issue itself, it's more about throwing the weight and throwing the name, because these gun laws and subsequently the radicalization around them is used to further radicalize more at-risk people. So for instance, saying you want to ban all assault weapons, that turns up the heat on this issue, but also saying you condemn or you condone, you support the events that happened in January 20th also turns up the heat on this issue. So if we take a break, take a breath, and we want to turn down that heat, we need to not so much stop talking about it, but stop. I didn't get that. So it's not so much we need to stop talking about it, but we need to stop turning up the heat. And by condoning and endorsing the events, we know what it's doing. It's not so much about protecting those rights, but you're sending a message to the people who hopped on. Because those meetings that have been going on January 20th, they've been going on for a long, long time. But suddenly certain groups got wind and it blew up into a massive thing. And you just didn't have people advocate simply for their gun rights to own assault weapons, to own pistols, hunting rifles. You had hate groups. You had the Proud Boys. You had people advocating for a second American Civil War. And that's not something you necessarily want to throw support around unless you know exactly what you're doing and you're hiding it behind a thin veil of this is for the Second Amendment. And I'm in support of protecting our amendments, but also we need to be aware of what actually happened. And it's a lot. It's a lot. But yeah, I recommend not throwing anything in either way at the moment until we can fully work on de-radicalizing these groups and actually touching base with the people affected by these laws and support actually hunting and all that fun stuff. Thank you.
Thank you. Is there anyone else who didn't have a chance to speak who wants to come up and speak? Yes, sir, please come forward.
My name is Richard Underwood. I live in the Four Seasons communities. I just want to remind the board that Van Buren Road is not a road at all. It's a proposed extension to an imaginary road. If that lower part never gets built by the builder, we will have a dead-end road that goes through Cardinal Grove and down by the way station and end. So I don't think you should assign money for a project that is that far from shovel ready. Thank you.
Thank you.
I'm not going to speak again, but I hate to leave my stuff behind.
Oh, sorry. I don't see anyone else lined up to speak at public comment time. This will conclude public comment time, which moves us on to item 6, actually 6B. We've done 6A. I will 6B since we've already received our presentation from Dr. Ansher and Mr. Meisner. Mr. Martino, you may take over the budget presentation workshops, please.
Well, thank you, Madam Chair, members of the board. We do have a few budget presentations to make to you. Before we get to those, I did want to share a couple of items. I want to take a moment to recognize the Human Rights Commission, who recently received a commendation from the General Assembly, and that was initiated by Delegate Rome. In her letter to the Commission, the delegate recognized significant and important contributions the Commission makes in the county, saying, "We understand the awareness and empowerment that this organization provides for the constituents in Prince William County." Human Rights Director Raul Torres and several of the commissioners, including Chair Curtis Porter, were on hand to accept the commendation last week, so I do want to congratulate them and thank them for the work they do in the county. I did also want to share that some folks from our Development Services Agency and Economic Development had the opportunity to meet with the Prince William Chamber of Commerce Economic Development Subcommittee yesterday morning, where there was a very good presentation, a good discussion about our commercial project management program and the Commercial Development Committee that's been helping us to streamline our processes over the last 20 years. We also had a discussion about providing more proactive service to small businesses in conjunction with our new arrangement with the Mason Enterprise, and some specific discussion about the agribusiness efforts that we're bringing forward. We're going to be talking to the board a whole lot more about these when we have our work session on the 31st about robust economy. But that was a very good discussion yesterday with the chamber. And the last quick announcement, our Parks, Rec, and Tourism Agency has been upgraded from an E2 to E3 with regard to the DEQ Environmental Excellence Program. This is a program that, well, we had to apply, but then the DEQ comes in and for a site visit and inspects our programs and our policies and how we're operating. It goes a long way to enhancing our environmental practices in handling materials and supplies and chemicals. You know, we have some heavy-duty chemicals in the pools, and all the way down to aerosols that are used in cleaning our many facilities. Also takes a look at how we are training our staff to operate properly and how we store the many supplies. So this does make us much more efficient. For example, we are buying many fewer single-use items. We're buying in bulk and consistently, so we don't have different product at every location. And it goes a long way to not only helping the environment, but making us more efficient. And so they've been upgraded to E3 level. Just an interesting sidebar, you know, our landfill is E4, which might seem like a oxymoron, but they do an amazing job out there at the landfill also. And we're all striving to have many of our facilities recognized in the Environmental Excellence Program. So those are a few items I wanted to share with the board. And then we have some of the budget presentations that we want to make to you, beginning with Community Services. Lisa Madrone is here from the Director of Community Services to begin that. Lisa.
Thank you. Good afternoon, Chair Wheeler, members of the board. I'm Lisa Madron, the Executive Director with Community Services. I'd like to acknowledge two of our board members that are here in the audience today from the Occoquan District, Mr. Obadiah Baker, and from Member at Large, Heather Page. Today I'll be providing an overview of the services and programs that we offer, a brief summary of the state changes that impact current and future services, challenges that we're facing that underline our requests, a recap of the unfunded request that was presented by Mr. Martino, and some of our long-term needs and requests that have been in our prior budget requests that would enhance or expand our services, and future considerations that will impact community services. Prince William Community Services is the first of now 40 CSBs established through the Code of Virginia as the single point of entry for public behavioral health, mental health, substance abuse, and developmental disability services. We celebrated our 50th anniversary last year. Our mission is to improve the well-being of residents in Prince William County and the cities of Manassas and Manassas Park who are affected by or at risk of developmental disabilities, mental illness, and substance abuse disorders, and to provide and coordinate community-based resources that respect and provide the dignity, rights, and full participation of individuals and their families. We also do this in partnership with other county, state, and community organizations, and we transform lives. These are our current programs with many services associated with these programs that we are offering. They range from same-day access for clinical assessments for serious mental illness and substance use disorders, to outpatient and community-based treatment, supported employment, medication management, and other specialty programs. All of our services and programs are aimed at improving the well-being and quality and life and connecting and engaging those that we serve in the community. Prior to 2017, we were mandated to provide two main services, emergency services and case management. As part of the state mental health systems transformation, the General Assembly in 2017 mandated that all CSBs provide 9 core services. This model has come to be known as STEP Virginia, Systems Transformation, Excellence, and Performance in Virginia, and is focused to address accountability, access, quality, and consistency across all CSBs to work towards excellence in behavioral health care and a healthy Virginia by fostering wellness among individuals and preventing crises before they arise. STEP Virginia has been mandated by the Code of Virginia to be implemented by July of 2021, although funding has not yet fully been provided or identified, nor have services with associated metrics or outcomes been fully defined. CSBs were mandated to implement 2 of these core services by July 2019. Those were same-day access clinical assessments for serious mental illness and substance abuse or co-occurring disorders, and primary care screening. This was implemented, and we implemented the same-day access assessments in July of 2018, and then the primary care screening this past July. The third step is outpatient services. This has begun. The goal of this is to get individuals who receive their assessment and are eligible for services into outpatient treatment within 10 days. Through partial funding from the Department of Behavioral Health and Developmental Services, we were able to hire a therapist in our adult substance abuse and mental health programs and in our youth program. Although the department realizes that CSBs need more funding to implement this step, and outpatient funding is in the governor's proposed budget, it is not clear, if approved, how much funding this will mean to us. The fourth step is crisis services, and the department has asked for a regional approach to expand crisis services for youth and to start crisis services for adults. There's approximately $1.4 million for the region that includes Alexandria, Arlington, Loudoun, Fairfax, and us. And we are working with our current partners around this. Further details for the crisis and the other 5 core services, which include peer services, psychosocial rehab services, veteran services, case management, and care coordination, are still being addressed and under development by the department. Another change that has impacted community services boards was Medicaid expansion. While this has been very beneficial for many individuals, and we are on target to meet the state cut that was taken from us, this cut was taken from a system that was already underfunded. We've had challenges meeting the demands for services now and in the past, so much so that the previous county strategic plan included 2 goals around decreasing our wait list to under 6 months. We did achieve that goal. The third area of state change is greater attention on an increase of outcomes and measurement tools for community services boards. Yet, these tools are not aligned with measures, and the definitions vary. And the CSBs that are very different have been compared and ranked. While the department continues to review and revise these dashboard measures, the CSB performance contracts indicate that reduced funding may be a result of failing to meet targets. We are faced with many challenges across all of our disability areas. And this slide represents those areas and the funding needs that we have. For example, in our Intellectual and Developmental Disabilities Program, which you heard a little bit on earlier in the proclamation, we have over 600 individuals that are eligible for case management services that are waiting for us to assign a case manager, and we don't have the capacity for this. Additionally, we have over 700 that meet eligibility for a Medicaid waiver slot, which basically means because of their disability, they should be receiving services in an institution or training center, and they are waiving that right in order to receive services in the community. If the General Assembly were to award those slots today, we would have over 180 that could immediately use those waiver slots for services. Over the years, the General Assembly has been very small in awarding the waiver slots. The last 2 years, we've received the most that we ever had. In 2019, it was 33 and 51 last year. And as was mentioned, we anticipate to receive hopefully at least that this year. But we will need a case manager to coordinate, link, and connect and monitor those services when those slots are awarded. Additionally, those folks that are waiting for services or may not waiting for a waiver slot or may not be eligible for a waiver slot also need services. And if the insurance doesn't cover it, they don't have a waiver, then we're looking to local funding to help support that. An example of that would be our transitioning students, our students with intellectual or developmental disabilities that stay in school until they're 22, as long as they can, transition out. And without funding for supported employment or an intensive day program to maintain their skills, many of them are left at home. Early intervention is our infant and toddler program for our birth to 3-year-olds. This program typically receives an increase of 7% in referrals each year. And these are infants or toddlers that have a developmental delay of at least 25% or a developmental condition. The periods for receiving physical therapy, occupational therapy, speech therapy are very, very critical in maintaining their development. This program has shown consistently that providing these services and the infants and toddlers that graduate from these services are over 50% don't require special education after completing these services. And we have a wait list for these services.
Madam Chair. Supervisor Lawson.
Thanks. Lisa, did I understand you to say there's a 7% increase each year? Oh, there it is. Early
Yes.
intervention. My
No
bad. I
referral.
should have read that. Well, I'm curious, why do you, that to me seems like a significant growth rate.
It is.
Why do you think that is?
I think it's a combination of factors. I think more and more part of our charge is to provide prevention in the communities and with pediatricians, and I think the more that is getting out there about autism or developmental disabilities that can have treatment, the more referrals that we are getting through the school systems and through pediatricians and families themselves.
Madam Chair.
Supervisor Bodie.
But in that same vein, usually we see that investment in intervention actually makes it so we're spending less dollars outside the back end when things happen later on, right?
Yes. In fact, there's been different numbers given out, but we've heard that for every dollar spent, it saves $7.
Right. So this actually isn't necessarily a bad thing that we're spending more on intervention than we would normally, right?
No, it saves money in the long run. And like I said, over 50% of those that graduate don't need the special education that are expensive in the school system.
Thank you.
Madam Chair.
Supervisor Lawson.
So to cliche this, a pound of prevention's worth a say it again.
An
Penny
ounce.
of prevention's worth
With a pound of cure.
Is that right?
Ounce.
Ounce. That's what it is. It's an ounce. Thank you. Duh. I should have known that. But that's penny wise, pound foolish. But that's essentially what you're saying here, right?
Yes.
And then you said that they graduate at 3 years of age?
They can transition at 2, but most stay with us until they're 3 because our services are comprehensive, whereas some of the services in the school system are focused on education. But we work with coaching the parents. So typically at 3,
And 50% do not need special education?
at least.
Thanks.
Our peer outreach program started as a community initiative to address the opioid crisis in our county. There was not funding in the budget for this initiative, and it was led by our deputy county executive, as well as fire and rescue was involved. We were involved in the health department. We had the opportunity to go after a state grant for 2 years that provided us with staff and peer supports that were going out into the community working with various populations to engage those individuals that were at risk for overdose or had experienced overdoses and get them into treatment. And we have served over 56 individuals in this program. The funding ends this September, and we greatly would like to continue this program and actually extend it if the county were to pick it up beyond opiates, as we've seen an increase in overdoses among cocaine and methamphetamine in the county. New Horizons is our youth services, mental health, and substance abuse program, and as you can see, it has a waiting list, as does our adult substance abuse and adult mental health programs. They have waiting lists, and that's one of the metrics from the department that we are charged with in terms of getting individuals that are eligible for our services into treatment within 10 days. We do not have the capacity to serve the demand. Same-day access, which is our clinical assessments. We started this a year early. In the first year, we doubled the number of assessments that we were providing to individuals. We were working with a state consultant, as all CSBs, and we were told that this demand would level off. It has not in our county, and we have actually been turning away 54% of the individuals showing up for these assessments because the demand exceeds our need. This is another measure that we're held to in terms of providing those that we're not able to make. Given the increase in requirements, we need support across administrative services to support the clinical supervisors and staff in meeting and maintaining the requirements and the regulations. This is our unfunded mission critical list and part of the budget request that includes the positions needed and the cost. Funding for these 39 positions and contractual services to support 30 individuals who don't have waiver would be 3.2 million local funding. We've also included the CoResponder request, which was on our complete budget request and also put forth by Public Safety. This is a pilot that we've been doing since the summer where we pair an emergency services clinician with the police and they go out on behavioral health calls in the community. This has been extremely successful in addressing the crises immediately, in engaging into treatment, reducing hospitalization, and definitely saving and using the police time more wisely. We try and get creative with space as much as possible. However, these requests do not reflect additional space needs that we have. We have maxed out on our space. Last year, when I presented our budget requests for 65 positions, we presented a phased funding approach for these requests over 5 years. And we've done that this year, over 5 years, to suggest, if not all 39 positions at one time, 20 the first year, then 8, and 3.
Madam Chair.
Supervisor Franklin.
Just so, if you all noticed the FTEs on the past, this is one of the questions I had. You notice for FY21, has it at 20, and those are full-time employees. Then FY22, you'll see that the number decreases, but just to be clear, those are the additional amount of employees that you'll be hiring.
Yes. Since we didn't receive any funding for the 65 requests, I wanted to include all of the requests that we had in addition to our mission critical ones. These would allow us to enhance existing services or expand services. And a request that we've had on our budget list for years, as well as the Sheriff's Department, I believe, have had this also, is our DORM, or a drug offender rehabilitation module program. We have a male and female treatment program in the adult detention center, and our male program constantly
Madam Chair, members of the board, I'm Courtney Tierney, Director of Social Services. With me today is part of our DSS posse, our Assistant Director for Protective Services, Phyllis Jennings-Holt, our Assistant Director for Benefits, Employment, and Childcare, Kathy Sumby, our Assistant Director for Homeless Services, Tony Turnage, and our Deputy Director, Ian Sansoni. Thank you all for being here and waiting. In human services, we transform lives. In the Department of Social Services, we transform lives through safety, support, self-sufficiency. The three programs I'm going to discuss today regard safety and self-sufficiency. The first is Child Protective Services, certainly a safety issue for children. We have an excellent partnership with our police department and do joint investigations. Their staff and our staff are forensically trained to assist with interviewing a child as completely and painlessly as possible. Most of our referrals come from Prince William County schools and police. When one calls the CPS hotline during regular business hours, an assessment is completed by an intake team. The result of the assessment is an assessment to a category, an assignment to a category. The most serious allegation is Category 1, and we respond in 4 hours. The next is Category 2, we respond in 24 hours, and the less serious category is 3, and we respond in 72 hours. If an assessment shows no need for an investigation, this is called a screen out. The intake team takes all the calls between 8 a.m. and 4 p.m., Monday through Friday, and assigns the case to an investigator. After hours, calls go to the state hotline for assessment, and the state hotline calls the on-call staff person who may need to go out for an investigation. One can always call police, who will also call our on-call person. We have 22 investigators in 3 teams. And this is the number of investigations that they did in FY19. CPS work is often very sad and emotionally charged. Staff must document everything effectively and clearly. Each investigation usually results in multiple interviews with collaterals and often ends up in court. To help provide staff with more work-life balance while also providing time for good documentation, we put together a pilot project. We assigned 3 staff to respond Monday through Thursday from 4 p.m., ending at 7:59 a.m. This staff did the assessments from the state hotline and police calls and the investigations, for example, the 4-hour response times. It worked well, and all of our staff reported satisfaction about being able to go home at a stable time each night. You see here that 31% of all investigations and screenouts occur at nights and on the weekends. We are requesting 6 staff to fill out a team so it can operate 4 p.m. to 7:59 a.m. Monday through Thursday and 4 p.m. Friday to 7:59 a.m. Monday, so that the other staff does not have to do nights and weekends. And the staff that does nights and weekends, that's what they do. We believe it'll reduce fatigue and burnout among staff while also serving children well because the investigators are fresh. For $175,000, we can hire 6 full-time employees for this function, which is essentially a 4th team of investigators. The Virginia Department of Social Services will provide $241,000 in support toward the total project of $416,000. DSS Benefits, Employment, and Childcare Division is our largest division with 153 staff. 91 staff members determine eligibility for the programs noted on the left. 62 staff determine eligibility for our largest programs, Medicaid and SNAP, and those application numbers are noted on the right. It's a lot of applications, and it's time sensitive. The applications denied are important to count because of the work involved in issuing a denial. Medicaid must be reviewed annually, and SNAP must be renewed at least twice a year, more often if there are changes to the applicant's situations. When adding this for last year, there were 148,011 applications to either determine eligibility in the first place or renew. Caseloads are high. We have had repeated audit findings in the external audit regarding timeliness and accuracy. The state funded 18 positions for Medicaid expansion. That helped with the additional applications associated with Medicaid expansion, but we still have a need to increase staff to fill the gap that existed before expansion and is still there today. And speaking of Medicaid expansion, I have current information to share that was handed out to you as of March 1st, 2020. And I don't have any, oh, there it is. That's cool. So you'll see, we've had a lot of Medicaid expansion applications. When I came to the board before regarding the 18 positions that the state funded, we were expecting 12,000 to 12,500. You see, we've had 14,930. And this just came available on the DMAS website. You'll see the website there. I think it's really interesting, and you can point on any of the counties or cities in the Commonwealth to see what Medicaid expansion has done in each community and what the persons that are receiving expanded Medicaid, what they are using it for. So high caseloads cause poor accuracy and burnout. Teams are large, posing challenges in effective supervision. And before we came to you with a request about staffing, we performed extensive continual quality improvements. Some of our CQI efforts have been to establish a quality assurance and training unit. This is helping in improving our accuracy. Audit findings are decreasing. The class and comp study allowed us to make some great changes to bring our workforce in alignment with the work. We've shifted from traditional social work to more transaction-based work, which requires different skills. We train new employees, and once they have satisfactorily completed the training, they are auto-progressed to a new decision band. We have improved staff accountability and customer response. Additional staff would help us achieve our goals of timeliness and accuracy. The $350,000 noted here for 11 FTEs would be supported by an additional $483,000 by the state for a total project cost of $833,000. The last unfunded need is also for self-sufficiency, this time with homeless services as homeless prevention. There's an informal network of faith-based and nonprofit organizations who provide one-time donations to individuals, usually between $50 and $200. This means individuals may need to go place to place to piece together enough funds to prevent their homelessness. Currently, there's $148,000 available from the Continuum of Care for Homelessness, awarded to Northern Virginia Family Service and Streetlight Ministries, and $31,000 in Prince William County Community Partner Funding, which also goes to Northern Virginia Family Service for homeless prevention, for a total of $148,000. Funds are used for rent and or utilities before arrears, late rent penalties, evictions to prevent homelessness. Due to high rent costs, it's not unusual for individuals to need between $2,000 and $4,000. So you can see going place to place for $50, $100 becomes very difficult for persons in the community. We'd like to prevent homelessness in the first place, and we are requesting to add $120,000 to the current $30,000 of community partner funds for homeless prevention. Furthermore, we'd like to see the current community partner funding transition to contractual funding. An example of the need is from our Adult Protective Services Unit. If a person is 60 years of age or older, they may be able to receive some state funding to prevent homelessness. If they are under 60, we don't have that. So, for example, Mr. T was a 60-year-old man who requested assistance with his rent. He works, but he became ill and was unable to work, therefore his rent was behind. He requested one-time assistance of $500. Through Adult Protective Services, we were able to help with that. Had he been 59, we would not have been able to help with that. He was able to return to work. Therefore, because he stayed in his housing, he has income to pay his rent and other living expenses. It can be that simple that can lead someone into homelessness. The goal would be for all providers, including the faith-based organizations, to pool funds and distribute funds with a uniform assessment, possibly delivered through our coordinated entry system. Record keeping would be streamlined so that frequent users who do not effectively move towards self-sufficiently would be identified with specific interventions towards success. This summarizes our highest unfunded needs. We believe we get a good bang for the buck due to the state support we can draw down. We believe our residents would be served well as we work with them to transform their lives. Happy to answer any questions.
Supervisor Franklin.
Yeah, so thank you so much for your presentation. Thank you also for chatting with me regarding your priorities for this budget year. Want to, tell you that certainly support a lot of those unfunded needs that we have here, particularly homelessness prevention, which is critically important. We've talked about the tent cities that we have, particularly on the eastern end of the county,